Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without the way, let's get started.
When giving discharge instructions to the client with vasospastic disorder, Raynaud's phenomenon, the nurse should explain that the expected outcome of taking a beta-adrenergic blocking medication is to control the symptoms by 1. Decreasing the influence of the sympathetic nervous system on the tissues in the hands and feet. 2. Decreasing the pain by producing analgesia. 3. Increasing the blood supply to the affected area. 4. Increasing monoamine oxidase. The correct answer is 1. Beta-adrenergic medications block the beta-adrenergic receptors. Therefore, the expected outcome of the medication is to decrease the influence of the sympathetic nervous system on the blood vessels in the hands. Beta-adrenergic blockers have no analgesic effects. Increasing blood supply to the affected area is an indirect effect of beta-adrenergic blockers. They do not increase monoamine oxidase, which does not play a role in Raynaud's disease. In order to prevent recurrent vasospastic episodes with Raynaud's phenomenon, the nurse should instruct the client to 1. Keep the hands and feet elevated as much as possible. 2. Use a vibrating massage device on the hands. 3. Wear gloves when obtaining food from the refrigerator. 4. Increase coffee intake to 2 cups per day. The correct answer is 3. Loose, warm clothing should be worn to protect from the cold. Wearing gloves when handling cold objects will help prevent vasospasms. Vibrating equipment and typing contribute to vasospasm. Tobacco and caffeine should be avoided. Elevation will decrease arterial perfusion during vasospasms. During an initial assessment of a client diagnosed with vasospastic disorder, Raynaud's phenomenon, the nurse notes a sudden color change from pink to white in the fingers. The nurse should first assess 1. Appearance of cyanosis. 2. Radial pulse. 3. Oxygen saturation of the affected fingers. 4. Blood pressure. The correct answer is 2. Decreased perfusion from vasospasm induces color changes in the extremity. The degree of decreased perfusion should be assessed by taking the radial pulse. Color changes progressively to blue with cyanosis and then red when reperfusion occurs. The oxygen saturation requires adequate perfusion for accuracy. A blood pressure will cause further constriction and reduction of perfusion in the extremity. Which of the following clients is at greatest risk for vasospastic disorder, Raynaud's phenomenon? 1. Young women. 2. Old women. 3. Old men. 4. Young men. The correct answer is 1. Vasospastic disorder, Raynaud's disease, is more common in young women and is associated with collagen diseases such as rheumatoid arthritis and lupus. A client has been diagnosed with vasospastic disorder, Raynaud's phenomenon, on the tip of the nose and fingertips. The physician has prescribed reserpine to determine if the client will obtain relief. The client often works outside in cold weather and also smokes 2 packs of cigarettes per day. Which of the following should be included in the discharge plan for this client? Select all that apply. 1. Stopping smoking. 2. Wearing a face covering and gloves in the winter. 3. Placing fingertips in cool water to rewarm them. 4. Finding employment that can be done in a warm environment. 5. Reporting signs of orthostatic hypotension. The correct answers are 1, 2, and 5. Vasospastic disorder, Raynaud's disease, is a form of intermittent arteriolar vasoconstriction that results in coldness, pain, and pallor of the fingertips, toes, or tip of the nose, and a rebound circulation with redness and pain. The nurse should instruct the client to stop smoking because nicotine is a vasoconstrictor. An adverse effect of reserpine is orthostatic hypotension. The client should report dizziness and low blood pressure, as it may be necessary to consider stopping the drug. The client should prevent vasoconstriction by covering affected parts when in cold environments. The nurse can teach the client to rewarm exposed extremities by using warm water or placing them next to the body, such as under the axilla. It is not realistic to ask this client to change jobs at this time. The nurse is assessing a client with Berger's disease. The nurse should determine if the client is experiencing 1. Thickening of the intima and media of the artery. 2. Inflammation and fibrosis of arteries, veins, and nerves. 3. Vasospasm lasting several minutes. 4. Pain, pallor, and pulselessness. The correct answer is 2. Berger's disease is characterized by inflammation and fibrosis of arteries, veins, and nerves. White blood cells infiltrate the area and become fibrotic, which results in occlusion of the vessels. Signs and symptoms include slowly developing claudication, cyanosis, coldness, and pain at rest. Thickening of the intima and media of the artery is characteristic of atherosclerosis. Vasospasm lasting several minutes is characteristic of Raynaud's disease. Pain, pallor, and pulselessness are symptoms of acute occlusion of an artery by an embolus or other cause such as compartment syndrome. A client with Berger's disease smokes 2 packs of cigarettes a day. When helping a client change smoking behavior, it is important to know the client's 1. Ability to attend support groups. 2. Goals for the treatment. 3. Perception of the negative behavior. 4. Motivation. The correct answer is 3. When helping a client change detrimental health behavior, it is critical to learn how the client perceives a situation or problem. The client is more likely to change detrimental health behaviors if he realizes that there's a problem and that these behaviors lead to the problem. While understanding the client's ability to attend group meetings, his goals for treatment, and his motivation may help facilitate change, the nurse should first understand the client's perception of the problem and then determine what strategies might work from his perspective. Which of the following clients is at greatest risk for Berger's disease? 1. A 29-year-old male with a 14-year history of cigarette smoking. 2. A 38-year-old female who is taking birth control pills. 3. A 54-year-old female with adult-onset diabetes. 4. A 65-year-old male with atherosclerosis. The correct answer is 1. Berger's disease is a non-atherosclerotic, inflammatory vaso-occlusive disorder. The disorder occurs predominantly in younger men, less than 40 years of age, and there is a very strong relationship with tobacco use. Diagnosis is based on age of onset, history of tobacco use, symptoms, and exclusion of diabetes mellitus. The nurse is monitoring a client after and above the knee amputation and notes that blood has saturated through the distal part of the dressing. The nurse should immediately 1. Apply a tourniquet. 2. Assess vital signs. 3. Call the physician. 4. Elevate the surgical extremity with a large pillow. The correct answer is 2. The client should be evaluated for hemodynamic stability and extent of bleeding prior to calling the physician. Direct pressure can be used prior to applying a tourniquet if there is significant bleeding. To avoid flexion contractures, which can delay rehabilitation, elevation of the surgical limb is contraindicated. The client asks the nurse, "Why can't the doctor tell me exactly how much of my leg they're going to take off? Don't you think I should know that?" The nurse responds, knowing that the final decision on the level of the amputation will depend primarily on 1. The need to remove as much of the leg as possible. 2. The adequacy of the blood supply to the tissues. 3. The ease with which a prosthesis can be fitted. 4. The client's ability to walk with a prosthesis. The correct answer is 2. The level of amputation commonly cannot be accurately determined until surgery, when the surgeon can directly assess the adequacy of the circulation of the residual limb. A longer residual limb facilitates prosthesis fitting and will make it easier for the client to walk. However, although these aspects will be considered in the final decision, they are not the primary factors influencing the decision. The client with peripheral vascular disease and a history of hypertension is to be discharged on a low-fat, low-cholesterol, low-sodium diet, which should be the nurse's first step in planning the dietary instructions. 1. Determine the client's knowledge level about cholesterol. 2. Ask the client to name foods high in fat, cholesterol, and salt. 3. Explain the importance of complying with the diet. 4. Assess the family's food preferences. The correct answer is 4. Before beginning dietary interventions, the nurse must assess the client's pattern of food intake, lifestyle, food preferences, and ethnic, cultural, and financial influences. A client with a history of coronary artery disease has been diagnosed with peripheral vascular disease. The physician started the client on pentoxifylline once daily. Approximately 1 hour after receiving the initial dose of pentoxifylline, the client reports having chest pain. The nurse should first 1. Initiate the rapid response team. 2. Contact the physician. 3. Encourage the client to relax. 4. Document the episode in the chart. The correct answer is 2. Angina is an adverse reaction to pentoxifylline, which should be used cautiously in clients with CAD. The nurse should report the client's symptoms to the physician, who may prescribe nitroglycerin and possibly discontinue the pentoxifylline. The client should rest until the chest pain subsides, and documentation is essential when a client experiences an adverse reaction with medications that have been prescribed. However, the nurse's top priority is to call the physician, report the problem, and obtain a prescription for nitroglycerin. The client's reports of symptoms should never be dismissed.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.